Hello and welcome back. In this section, we're going to continue with the skeletal system, but we're going to start exploring about your joints or articulations, as they are called. And when we look at articulations, we can look at them structurally and we can look at them as far as the functions they have. And in this course, we're just going to look at the structural types of joints. And there are three structural types of joints, and they are fibrous joints, where the two bones are connected by different types of fibers. The next is cartilaginous joints, where the two bones are connected by pieces of cartilage. And the third is synovial joints, where there is a synovial cavity. So let's get started. A fibrous joint, as the name implies, has fibers. And because of that, most of these joints do not have movement between the bones. There is no cavity between the bones. Instead, they are connected by dense connective tissue. Think collagen fibers. The length of the collagen fibers is often very small, like millimeter. In some cases, it can be longer than that, however. And a classic example of a fibrous joint is that seen between the flat bones of the skull. And so you think of that as your example in this course. Of course, if you're going to be taking anatomy later on, you will be learning about other fibrous joints because there's actually three different types of fibrous joints. The second type of structural classification are cartilaginous joints. These are going to be slightly movable, but they still have no cavity in them. So notice both the fibrous and the cartilaginous joints have no cavity, so their movement is limited. What is different is cartilaginous joints are connected with extra cartilage. So the bone is still going to have its normal hyaline cartilage, but now we're going to have an extra piece of cartilage in between. Now, notice I'm not telling you what type of cartilage is going to be. Well, we know it can't be elastic cartilage because there's elastic cartilage only in three places of the body. But depending on where this joint is, it could be hyaline cartilage or it could be fibrocartilage. So between the vertebrae, we've already talked about how we have fibrocartilage in our intervertebral disc. But between our ribs and our sternum, this piece of cartilage that you see right here, this is hyaline cartilage, not fibrocartilage. And so both of these are examples of cartilaginous joints. And there are other cartilaginous joints in your body as well. Now, the third type of joint is the synovial joint. And what is different about this is that this is the type of joint that has a cavity. So think about having a little water balloon between the two bones. And because of that, it makes it freely movable between the two bones. Now, there are going to be required components for this joint, and then there are going to be some options. So, kind of think like in an automobile, there's required components. You must have an engine, you need some sort of steering component, you need some sort of brake. And then there's options, air conditioning, a radio. Those are options. So, there's different types of synovial joints. You learned about some of these in grade school, like the ball and socket. In anatomy, you will learn the 6 different types of synovial joints if you're taking anatomy. We're not going to go through them in this class. And they're synovial joints, pretty much every joint in your upper and lower limbs are going to be synovial joints. So like your hips, your elbows, your knuckles, your shoulders. But we also do have some synovial joints in our axial skeleton as well. So come on back in the next section as we explore synovial joints in much more detail. See you shortly.